Hi, Dr. Muneer. Would you want to switch on your camera? Here you go. All right. Good afternoon, everyone. My name is Sebastian, and thank you for joining us on this live talk organized by the International Medical University. And this afternoon, we have with us Associate Professor Dr. Muneer, who will share with you on studying dentistry at IMU. Now, for your information, Dr. Muneer is the Associate Dean for Oral Health at the School of Dentistry. Now, of course, before we begin the session, a quick moment for housekeeping. We have muted everyone by default. And if you have any questions for Dr. Muneer, you're welcome to use the Q&A panel. I would like to repeat this once again. If you have any questions for Dr. Muneer, you're welcome to use the Q&A panel. I shall now pass on the time to Dr. Muneer. Over to you, Doctor.
Thank you, Sebastian. Thank you very much for the kind introduction. So, welcome everyone. I'll be your presenter for this live session. I'm Associate Professor of Dental Public Health, and I'm affiliated with IMU since 2008. So I've seen the program developed. I've seen a lot of our alumni graduated, and they are in all around the world, and they're in very good places now. So I'll just go through some slides, and after this we can have discussion or Q&A session. So as you know, we always say dentistry is not everybody's job. Training is required. Why we say this? Because as a dentist, you need to have psychomotor skills. And psychomotor skills means that you need to do fillings, give anesthesia. So all these things, you need to have hand-eye coordination and a lot of these things. So these things may look very easy, but they need proper training. And training means that there must be some structured program, and based on this structured program, you can go to next stage after passing the competency test and things like this. So dentistry basically, or Bachelor of Dental Surgery, is a member of primary healthcare profession on the front line of disease prevention, intervention, and wellness. So that's one more big reason why we need proper training, because it's a profession, and professional needs to have proper training before they can profess and before they can start treating their patient. So dentists are often first healthcare professional to recognize and identify a wide variety of diseases ranging from diabetes to oral cancer. They diagnose and treat problems affecting the teeth, gingival tissue, tongue, lips, and jaw, basically the head and neck region. These oral diseases often reveal the health issue that may require follow-up with the patient primary physician. So we are just like kind of most of the diseases nowadays, like hypertension, heart diseases, diabetes, and so many other diseases, their first symptoms are seen in patient's mouth. So that's why during the training, the student go through different stages to recognize all these signs and how to report them, and how to plan treatment for them. So dentists provide services that improve patient appearance, you know that, and the self-confidence through a wide variety of cosmetic dental procedure. So in that case, a lot of training is required. So now what is basically dentistry? So dentistry basically involves the diagnosis, which is the identification. In normal sense, I can give this example that you see any problem, the first thing is you have to identify, is it a problem or not? That's why we have to do diagnosis. Then prevention is one of the best strategy. Prevention is to how to avoid. Like nowadays we have in this pandemic, we have social distancing or physical distancing, hand washing, and all these steps. These are for prevention. So prevention is the thing that they can avoid, and treatment. Treatment means that the patient already or the person already have a disease and how to treat that thing. And the disease or treatment of oral diseases to that kind of dental caries or tooth decay we call it, or gum problem like bleeding gum problem, or any other problem, soft tissue problem, jaw bones problem. It includes the care for health, function, and aesthetics. So aesthetic has become a very big part now. So what we do is we for the patient, so their form and function both are replaced again through treatment and treatment planning. So Uh, as I said earlier, becoming dentist take an interest in science and a desire to help people, but a dentist also is an artist, a scientist, and a business person. Dentistry is a very unique profession that you yourself, being a clinician, you are a kind of physician also, and you are a business owner because you have your own private practice, you are your own boss. So there are very different kind of personality traits which are required to be a dentist. One of the most important thing is desire to care for people. That is the most important thing. And if you have this desire to treat people, to alleviate their pain, so this is one of the important thing. Then empathy then means that you have to understand what they are going through. So that's very important. Manual dexterity, yes, it's extremely important because you have to work in a very confined space like mouth, and after that the space is like a tooth restoration is quite a small piece of work. So that's why you need a lot of manual dexterity, and in our curriculum we start this from very early on in the curriculum to train the students how to do fillings, how to design these restoration, how to make these restoration more pleasing or natural. Eye for detail is quite important. As I said, the field of work is quite small, means the mouth is a small area, and then you need to have a detail, for detail. So you can see that you can read the X-rays, you can see the lesion that what type of lesion, and there are so forth, so on. There are a lot of things, and then patience. Patience is quite an important aspect because you know that sometimes people in pain they can react differently. Sometimes the treatment planning take a lot of time, and then you have different types of patients. So that's why you need patience. People skill is, I personally think, is one of the most important skill that you need to have because you, as I said earlier, you will be a business owner also, which is your private practice. So you need to have very good people skills, ability to for work in team. This is like a very major thing. Now we have integrated care system. So in one hospital or even one dental clinic, there is a specialty clinic. There are different specialists or general dentists are working. So you have to work in a clinic. In fact, on chair side, when you are treating patient, we call it four-handed dentistry. You have operator and you have assistant, so you need to understand each other. That's why teamwork is quite an important. And lifelong learning is one of very important aspect of any health profession, because the treatment protocols change, the guidelines change, the medication change, a lot of things change. You need to be all the time updated on what is the best. It should what we call it evidence based patient centered treatment. So, dentists are scientists and artists both. I mentioned a bit earlier that you have to do, as a dentist, you have to do aesthetic restoration, you have to create dentures, you have to create a lot of these things, and all these things, every patient want them to look natural. So, in even our program. So this is a picture from one of our session, which is in semester 2. So in that the student they draw the facial anatomy, the nerves, arteries, face, muscles of the face. They all draw to learn where these muscles are, how they function. All these things they are drawn. So they learn from each other. So we have their supervisor there who teach them about it, and it's quite an important way of learning. So by this you can see like in this education aspect they are an artist and a scientist also. But in this other aspect, scientist means like if you are doing a restoration, which filling material is the best material for this patient in this context. And then when you choose that restoration, you have to make it as natural as possible. So the when the somebody else see the patient, they don't recognize where is the restoration done. Means this they are tooth colored, and there are different treatments available. So scientific skills are very important. Plus on this, one of the important aspect here is you have to apply your science and create better results. So all the students studying dentistry at IMU experience exciting atmosphere. We start very early on exposure to the clinical cases. So the student from semesters 2 onward, they go to clinics. So in clinics, they see what we taught them in the classroom or medical museum or skills session. So they can see that how all these things are applied. So there are more opportunities for the student in the senior semester. We send them to outreach clinic or elective posting. So they go to different places. They see how what is written in the book, what we tell them in the classroom, and how it is applied. So creating that in context is quite important, because from book you can see that yes, these things are good, but in real life when you see them, that how they function and how they are done is quite an important thing. So with along other thing, so one of the important aspect of our program is early exposure to the clinic or clinical environment. So the other before I go into the curriculum detail or the program detail, I'll just would want to share something about the IMU dental program, like a bigger picture. So we have the program, we have two options. One is full IMU program in IMU, so IMU BDS. The other is the partner dental school track. So what happens there in the this orange color, you can see the student are, we have divided the program into two phases, phase one, phase two. In phase one, 2.5 years, the students stay with us until semester five. They go through a program which is almost similar to the partner program. So we all the partner school agreed that yes, we have the same outcome, same learning happening. So that's why for the 2.5 year they are here. After 2.5 year, some of the students they stay with us. They complete the bachelor's degree from IMU, so the next 5 semester. The other, they go to Canada, UK, Australia, or New Zealand and complete their degree in 2.5 or 3 years from these countries. So all our program or the curriculum is designed by, so our main thing is the three I's of IMU: innovation, imagination, and insight. So our program is nationally recognized for excellence. We have recently got our Malaysian Qualification Agency approval for the next 5 year, and they have given us quite a commendable report that we are doing a lot of things which are quite state of the art. So our program is nationally recognized for excellence in evidence-based dental education, use of innovative technology in teaching and learning, and patient-centered care that is driven by IMU mission. So now we have our School of Dentistry vision for our students, that our graduate will be exemplary, compassionate, responsive, who are capable of delivering patient-centered, evidence-based care. So patient-centered is very important, and evidence-based. Evidence-based means that, as I mentioned about lifelong learning, is that we have the evidence that this treatment or this medicine or this procedure has some evidence. It has worked before and scientifically proven that it will work, or this material is good enough for the student. Patient center is that previously 20 years ago or 15, 20 years ago, most of the decision were made by the doctors. Now we have to that take the patient as a partner in decision making. So that's why it's more patient centered. So we have to include patients. That's why we train the student from the day one, that why the patient is an important part of this whole thing. Previously it was not like this. In few years back, it was the doctor who was always the main person who was talking and giving information. So in our vision, we using contemporary technology, our students will be resilient, adapting to diverse and changing environment, just like current environment. So now, because of the pandemic, a lot of things have changed, and we are working quite differently. So these things, our students need to be resilient to all these things, and advocate for better oral health and healthcare through leadership, entrepreneurship, and interprofessional collaboration. Interprofessional collaboration, we have opportunity for student, because I mentioned earlier that the doctor will be working together with the medical colleague, with pharmacy colleague, with nutrition dietetic, different people. So they have to learn this interprofessional collaboration, and they know what are the important aspect of that profession, which is augmented our or helping us. So this is just a snapshot of IMU, dentist of the future. What is our vision, that how we want to see our graduate in the future. So a little bit about our curriculum. So our curriculum have three main principles, that is authentic learning, personalized learning, and integration. So all these things then work in coordination with simulation, which means we have a dental skill center, oral health center, that is clinical assessment, community engagement, and technology enhanced learning. So we have tried our best that all these things augment each other and support each other. And assessment is for learning, because for us learning is quite an important aspect rather than teaching. So learning is quite an important thing, because it will help the student to become a lifelong learner, use different technologies, and they develop that passion to develop themselves and treat patient better. So this is a very exciting thing about our curriculum. These are the key features of the BDS 2021 curriculum, which will be from February intake. They will be using the new curriculum. So we have introduced micro credentialing. So one is you will get a BDS degree, definitely. The other thing in micro credentialing is that when the student achieve all the Malaysian government requirements by semester 9, so in semester 10, we will offer them short courses that can be on implant dentistry, aesthetic, endodontics like root canal treatment, or different things. So they can earn those certificate also. So when they graduate, they would have already some value added, another um, certificate with them. So we have early clinical exposure. The student from SEM 2 onward, they will have early clinical exposure. They will go to clinic and see how the real world dentistry work. Data science analytics, we have introduced this in curriculum, because the future, you can see now everything is online. Future is data. So data is the new oil. So data will drive a lot of things, and our graduate will be able to use this data for their advantage, like what type of patients are coming, what are the new things. So that's why data science is quite important. Then team-based integrated learning, this is also a very innovative thing we have started. And there will be this is basically for integration. So we have a basic scientist and a clinician in classroom, and they will be teaching the student. So the student will see both the aspects, rather than separately they are in a basic science and they go to a clinic. So we just in the classroom also show them the both aspects. So yeah, this is for when the curriculum start. The student have to learn about biomedicine in relationship to dentistry, and they learn this through key clinical problems, which is also a very new innovative things. So these are the key clinical problems for the students. Like there will be a clinical. We are not teaching everything anatomy separate, physiology separate, all these things. So we have put them together in different key clinical problems, so that then the student can apply these knowledge. Like for example, chest pain and palpitation, wound, jaundice, shock. So all these things the student will cover, so the basic scientist and the clinician will help them learn this. Then, as a future dentist, as I mentioned earlier, that one of our very important aspect is most of us we have private dental practices or student start dental practices. So from early on, from the in the program, we have introduced group dental practice. So the group dental practice is there. The senior student will be kind of running a group practice in our clinic. So this is basically authentic learning. So they will learn how to do their budgeting, because we are also teaching about them how to run a clinic, how to hire people, how to treat, how to refer. All these things they will learn in a group practice in a real life. And they will be definitely all they will be supervised. The lecturers will be trained as a coach, as a mentor, and as a supervisor to assist them in this endeavor. So the other very major module is dental science and practice. So we have integrated the science part of dentistry and practice, and the student will mostly work in the clinics after first briefing and in the dental simulation center and classroom, and then they can go to clinics to apply this knowledge. Okay, micro credentialing, I mentioned it a bit earlier. But about micro credentialing, it is the opportunity to enhance skills in more advanced dentistry, such as implant dentistry, microscopic and rotary endodontics, digital dentistry, scientific research and publication. So these are different things. So the student, based on their interest, they can take any of these courses, and these are few. There will be more also we are offering. When the student graduates, so they will have additional qualification with them, kind of a certificate. uh, we have like we want our dentist or our graduate to be a holistic person, like they have it's not only they are very good clinician, but they are very good human beings. It's kind of, I always say, we want to make the doctors human again. So clinical humanities and well-being is a module which starts early on. So first semester is about introduction to university learning, because university learning is quite different than college learning. We are more student centered than teacher centered. So a lot of these things we will teach the student how to cope with them, how to work in a university environment. So if you can see the topic like communication skills, ethics and law, that is related to dentistry, clinical reasoning, dentist and the society, then entrepreneur or dentrepreneur project, leadership, all these things will be covered from SEM 1 to SEM 10 in different themes. These are our core values. I must introduce them. Our graduates are known for these core values, and we are known for these core value. And our curriculum, like our all the curriculum, is based on these core values, and these are the main tenets on which we work. Okay, all these things, when we develop curriculum, it's not that few of us sit down, we develop curriculum. You can see like in different pictures. We have group photos. So we met our alumni, we met our stakeholders like ministry, our partner school, and different people. And we got ideas from them, got feedback from them, from our alumni, that how our curriculum is. Then we also got feedback from the employers of our alumni, that how our alumni are functioning. So based on all these things, we have made our new curriculum. So I'll just quickly go through the learning resources. So these are our learning resources, which are in medical museum, in our problem-based learning room, the microscopes, indoor microscopes. And you can see that in clinics, the students are applying the same things. If you look here, they are studying about radiography in a small group teaching, and then the same aspect here in a clinical situation, they are discussing the same with the patient, so they can apply all these things in a real world. So this is our dental skills center, which have all the phantom heads. The student learn how to make cavities there or make dentures. All these things are done in dental skills center. These are other resources like library, our auditorium, and e-labs. Okay, this is one of the very important aspect. We are for us, student engagement is our engagement is quite important. We have a lot of opportunities to make sure that the lecturer and the student, they have interaction, they know each other because we work as a team. And then our lectures, like here, we won a lot of awards for our technology enhanced learnings, and it is quite an the student engagement and faculty development is a very important aspect of our school. Community engagement, these are, I'm really proud, these are our students who have won awards in 2016, 2020. We have won awards for community engagement, and then the students, they have different projects and they have improved lives, not even in the clinics. They went outside and did a lot of things for patients outside. So, how to instill community engagement? So, we have early on in the some program, we have oral health awareness week where the student, they meet or give oral health education and health promotion to other students and the Bukit Jalil community or anybody who can come. So that one week they have different program on oral cancer, gum problem, diabetes. So they are integrated program and it's quite useful for them to learn. And this is how they do their experiential learning or service learning. So these are some example. So this picture on the left side with the black shirt, this one of our student is teaching a blind student how to floss and how to brush. And on the right side, this picture, so this student, this child is hard hearing, and our student was trying to help them how to maintain their oral hygiene. So we have a lot of student engagement and sports activities. So you can see on the top left the picture here. So we took out the student out of the classroom into a real world. So it was for training for leadership and teamwork. You can see we were crossing rivers. So how to, as a team, do all these things, like how to be a very good team and how to act as a leader. So we have a lot of these activities for the students, and these are co-curricular activities. Means that there are basically co-creation. So the students are fully involved in the creation of these activities, so they know that how these things are done and all the planning. So a little bit, because nowadays a lot of things on e-learning, so webinars. So these are our classrooms. We have recorded lectures. We have a video library for our demonstration where anywhere, anytime learning student can do. And we are now for our own dentistry, we are creating a video library for all the procedures which the student can learn. This is from feedback from our students of all the 5 semester. They told us what they need, and based on that, my team, our faculty, they are developing videos for them. So we have community field visit where they go and see, like for example, dental public health. If something is very in the classroom, but then they go out in the real world. This is when the student visited the fluoridation plant, how the water is cleaned, the rainwater is cleaned and made, and it is drinkable. So how to add fluoride into this. So the whole procedure, they go to the ministry and they go through this whole procedure and they see all these things, how it is done. Then elective module is something very important where this is non-core. The student can do mountain climbing, boxing, whatever they want, but they have to show that how it impact them as a future dentist. And they come back and present to us. Like some even student went to South Africa, some to Taiwan, China, different places, and they did some projects there and improve. One student went to learn Thai boxing, and a lot of these things for resilience, and they have learned that. So these are our students who have won a lot of awards in research. We are from SEM 7 onward, we have research module, so which is quite an important aspect. And student published and won a lot of award. Plus, our student at the top, sorry, the lower left picture. This is one of our students. She was the president of Asia Pacific Dental Student Association, and after 18 years she brought the very big dental student conference to Malaysia, which was a 1 week event, and it's a mega event for the dental students of the world. So she was the president, and after this the Malaysian Dental Student Association president was our own recent graduate. So this is when the student achieve all the competency, pass the professional exam, achieve the Malaysian minimal clinical experience and expected clinical experience, then they will graduate. So our aim of this whole program is that we want safe dentists. So that's why a lot of things quite rigorous for them. This is the picture from the student when they graduate from Partner Dental School. Okay, now as a dentist, the most important question, like once you graduate, what's next? So after BDS, you can become a dental officer. Basically, this is, sorry, it's written wrong. It's a 1 year compulsory government service they have to do. Then they become a dental officer. They can become a trainee lecturer. We have our alumni, about 6 of them. They are trainee lecturers with us, and they will be soon joining us as a faculty member. So it's a quite an exciting thing. Then dental officers, uh, like they work in ministry and they follow the ministry pattern. In fact, mostly now they are doing post graduation. They can do in all the 9 specialties. They can choose one and they can take the post graduation there. They can become a dental public health administration officer, or they can do fellowship, PhDs. So it depends how much the student interest is and where they want to go. So a little bit about our alumni. So these are our alumni. Ming Yen, the first picture on the left side, she's working in Singapore. Lee John is in Malaysia. He graduated last year. Regine is in Australia. Lim Viren is here in Malaysia. So they are all well settled. So from this map, you can see that our alumni are in Canada, United Kingdom, New Zealand. A lot of them, they are in New Zealand, Australia, Singapore, and Malaysia. And this is our information page. I have put the QR code. If you want to learn more about the faculty, who the faculty are, so you can scan the QR code on the left side, or you want to read more about news about the student achievement and what students have done, which is published through the IMU news, online news, the Pulse of IMU. So you can get all this information from there. So thank you so much. And now, after this, we will have some Q&A session. Please feel free to download. This is a Teeth Talk magazine published by our student. It's quite a good magazine, and it's sent to all the dental clinics around in Klang Valley, in different places, in fact. So this is the online version. So you can scan this and you can download this magazines. Quite an informative magazine about a lot of things you want to know about as a patient or as a dentist. So you can download it through this QR code. And if you want to connect with me, I'm available. I'm on LinkedIn. I'm here. My email address I can share. And you can, if you have any question later, you can send to me. Right now, we'll go to Q&A. Sebastian?
Thanks, Dr. Muneer, for an insightful presentation. I think I have to make a visit to the dentist tomorrow. For dear audience, if you have just joined the talk today, we have with us Dr. Muneer, who have just shared about studying dentistry at the International Medical University. If you have any questions for Dr. Muneer, please use the Q&A panel to post your questions. Now, Dr. Muneer, let me commence the Q&A session with the first question.
Okay. Okay.
Yeah.
Yes.
What is the recognition of IMU BDS? Can student actually work overseas after graduating with the IMU BDS?
Okay. This is a question which generally a lot of parents ask from us. One is recognition, one is accreditation. So recognition is yes, they can go to any country. Most of the countries now they have a system. Like for example, they go to UK. UK they have their exam, General Dental Council exam. So they have to go through that exam, and then they can start working. They have to take that training, the foundation training there. So that's one thing. Australia have their exam, US have their, Canada have their. So all our students, less like anywhere in the world, our students are also eligible to sit for these exam, because most of the countries now they are trying, like even Malaysia will start professional qualifying exam. So this is because all the every countries have different type of dental problems. So they based on all these problems, they have a criteria that for them a competent dentist means this. So then they have an exam. They want to see benchmark them in a way that all the dentists working in Malaysia, their minimum standards or competence is this. So that's why they have to have a system. So that's why they have to have that these exams. So wherever like Europe you go, in North America, these exams are there. So yes, our degree are accredited in a sense that they can go for the exam and they appear there in the exam.
Oh, okay. Thanks so much, Dr. Muneer.
Welcome.
About the partner dental school program,
Yes.
would you be able to share a little bit about how does the matching process work?
Okay, so the matching program is all our partner school. They have the first in this whole process. Most important thing, the student at the point of entry tell us that their first preference is, for example, University of Otago. Second is Adelaide. Third is Glasgow. So forth, so on. They will tell us this. So once they reach to semester 4, so based on their performance and attributes is like means like class participation, leadership, what are the other things more than a dental student they have done. So these attributes, like different university give weightage. Some university give more weightage for leadership, some for more class participation, some for teamwork, different things. So these things are also then the student's mentor will give scores for the student, and then these weightage of their means their this performance in the assessment from semester 1 onward to sem 5, and all the attributes they will be put together and they weigh against that the different schools, like for example, as I mentioned, one of the university leadership is very high. So if this student their first option is leadership is very high, they automatically match there. So mostly the student they know that the what they need to do. So far, if I'm not wrong, in last 10 12 year, most of the students have got their first option, or maximum they can go to second option, but mostly they will get first option and they will go to their partner school of their choice.
Wow, that sounds like a complicated process, yeah?
It looks complicated, but it's quite easy. Once the students are in the system, it's quite easy. They know that what is the pathway, because we give them briefing. They have few briefings, and their senior students also brief them. So, and the students are quite knowledgeable about this, that how this whole process will happen. And so far, like we never had any issue with any student having they have dropped out from a partner program or things like this. Generally the students are quite fluent about this. They know about it, how it's done.
Sure, thanks, Dr. Muneer. Now, we have a question from the audience. It's also about the partner dental school track. He
Yes.
asked about can a student actually who have taken that particular track work in that country and also undergo the housemanship? But I think to our knowledge, there isn't any housemanship. It's particularly just a in-house.
Yes,
Yeah.
yes, correct, correct. So in dentistry, most of the countries, like our partner school, we don't have like housemanship for dentistry. It is inbuilt in the curriculum. So once they graduate, it depends. Like in UK, so just few last week I was talking to one of our alumni. So she's now working in Nottingham, and she has worked for Public Health UK, Public Health England. Sorry, she has worked with them, and we have our alumni who are working now in Canada, New Zealand. I show all of them. So generally, like in UK, they have their degree automatically recognized there. They can work there. So far, they don't have any problem. Australia, our student graduated and they have started working because they have the Australian Dental Council accredited degree, means the degree is Australian degree, so they can directly go into the system. So they have some definitely immigration requirement which they have to fulfill. Other than that, mostly they have like in New Zealand they got a job, they are working. Canada even, and one of our mentee contacted me, so he's moving to US to work there in a university. So yes, they can work. But the other thing is with changing world in future, like I can't predict the future that what will happen, but currently yes, they are working.
Thanks, Dr. Munir, for the
Welcome.
explanation. We have a question about the PG diploma and the Master of Dentistry.
Yes.
What is actually the difference?
Okay, masters is it depends. PG is very basic. Like in Australian this context, I can explain very easy that you are a general practitioner with special interest. Means that you have not reached to specialist level. For masters, generally now dentistry have a 4-year master program. Once you clear that, you become a specialist. But for postgraduate program, you take one small aspect of that and you work on this, and you become a dentist with a special interest, like you have interest in implantology or endodontics. So then you take that and that small area you develop, and then you are known for that. Like a lot of people are doing implant dentistry, so they can do simple implants. They are very well trained in this, or endodontics, so they can do endo treatment. But the Malaysian government, they have gazetted that to be known as a specialist, they have to do a 4-year program. So that's the major difference here. So the training is the time is different. One is 4 years, the other diplomas are generally 1 year.
Right, okay. The audience, we would just like to share with you that the IMU, apart from offering the bachelor's degree in dentistry, we also offer a pathway to postgraduate diploma programs in endodontics, prosthodontics, as well as implant dentistry.
Yes.
Yeah. We have a question. I think I can take on that question from Young Wanchi. She is asking whether OSMAT be accepted for dentistry program. The answer is yes. What marks is required? That would really depends on the program track you're applying for. We have the local track as well as the PDS track. So the requirement differs depending on the track that you would like to apply for. So let us, probably you can send us your academic grades and we shall look into it and share with you more on which track suits you better. Dr. Munir,
Yes.
February intake, which is our intake for the dental program, how is
Yes.
it conducted online or how is it going to be? Any idea?
Okay, first, most important thing is the government advisories. Currently, the program we will start as first few weeks are definitely online. In fact, until June, it will be hybrid, mostly online or things where the student can come to need to come to campus, so they need to come. But generally, what I understand is until June, majority of the work is online because the skills training and clinical exposure, all these things start from SEM 2 onward. So they will be mostly required to come to campus for dental skills training or clinical aspects. So that will come a bit later. So until I can say safely that until June, it will be a blended learning or online learning.
Wow. Oh, okay. I think we have a lot of questions coming in. Okay, I'll take on this question from Zainab. He's asking about upon completion of the degree, uh, the student needs to spend a year of compulsory government service.
Yes.
We will send them to any hospitals or they need to locate one on their own. The answer is that you have got to apply to the respective government agencies and they will assign them to the hospital, right?
Yes, yes.
Okay. All right. We have another questions basically. What makes IMU different from other dental schools in Malaysia? Dr. Munir.
Okay, that is just like through my presentation, I mentioned one aspect is our early clinical exposure. The other is integrated learning. So, in other programs, what they do, they have separated the basic sciences like anatomy, physiology, dental anatomy separate. So, they teach it separately. But the thing is, for the student to understand, like if I learn something in SEM 1 and the application is in semester 7, so by then mostly I can't make the dots. So that's why our integration is quite good. So we have integrated the basic sciences and clinical sciences. That is, I personally think, one of the very big achievement of our program, and it did not happen overnight. It took us about 5 to 6 years to achieve that. Plus the micro credentialing, none of the program here. Then one very main aspect which I did not say here, because right now most of the people may not have heard about it. We are the first dental school who are starting interestable professional activities, which is I don't want to go into that details of that, but these are the activities which will ensure that all the graduate, they are very good clinicians and professionals. So the process start from SEM 3 onward, and there will be a kind of a longitudinal assessment like SEM 3 onward until SEM 10. We will assess them with different streams as a clinician, as a professional. So when they graduate, they will be really leaders in their field. And our students have proven this before. As I mentioned, they were presidents and vice president of Malaysian Dental Student Association or different aspects. But few main things are like micro credentialing, early clinical exposure, data science, which is something very new for a dental student to go into data science and learn data science. Then integration, I mentioned the task-based integrated learning. It's a quite unique idea. And in fact, some of the other schools, they want to learn from us how it will be done, because it's something really interesting. And we develop this from feedback from our stakeholder, like our students, alumni, our ministry partner, like Ministry of Health and Defense, and our partner dental school. So based on all the feedback and plus the employers' feedback, so we develop this thing, integration. So integration is quite good.
Wow, that is an interesting explanation.
Yeah.
Uh, Dr. Munir, we have another question. For students who are doing the IMU BDS, where do they do their clinical practice?
We have our own oral health center. They do practice there, and we will have in the future. In fact, the students, because of the COVID, are not able to go there. We did not started that, but we have an outreach clinic also for the student. Plus, but to answer that, mostly they are doing in oral health center in IMU.
All right. We have two more questions which I can help and take on those questions. This will be a quick one. When is the deadline for the application to BDS program? In fact, it's already been open some time ago. Basically, we go on a rolling intake where once the places have been filled up, then the intake will close. So it's very competitive. If you want to put in an application now, you can still do so, and the admissions will process your application immediately for the upcoming February intake. Another question is about payments. How are they being made? You can pay your tuition fee on a semester basis. All right. Um, Dr. Muneer, we have another question. You shared
Yes,
about teaching, learning approaches in dental program that include
yes.
problem-based learning, patient simulation practicals. Can you probably help us to elaborate a bit more on this?
About
Maybe problem-based learning, how do you do the patient simulation practicals?
okay, we have a dental skill center in which we have, which I showed. Wait, I'll just, sorry, I'll just go back a little bit. So, anyway, so we have our dental skill center where the student will start learning about how to even cut a cavity, which, as I said earlier, it looks quite an easy thing, but it is not as easy. So we have to teach them. This is our dental skill center. You can see the students are learning how to use a rubber dam, how to like means for infection control, how to make a cavity, and then how to fill, how to read the radiograph, and all these things. So this is the place where they learn. So this is one place. Then the next place from here, once the students have some required number of session, they clear those session, and then we have a competency test. Once they pass the competency test, they are allowed to go to clinic and practice that part, means like scaling and polishing. So they have to pass the competency test and do scaling and polishing in the clinic. So this thing is then connected with the classroom. In the classroom, we will give them a basic idea. So in task-based integrated learning, which I mentioned earlier, so the clinician will tell them about what are the clinical aspect. Basic scientist, for example, the biomaterial scientist will tell them what are the different material, what are their properties. So they can both combine. From classroom, they come to skill center. From skill center, they go to clinic, if you take the flow there. So this is how we will be doing it, or how we are
Wow, that.
doing.
Mm. All right. Thanks, Dr. Munir.
Welcome.
Right. I think we can only take on a couple of more questions due to time constraint. I can take on one of the questions. What about next year's February intake? I believe the audience is asking about 2022 intake. When will the application be open? Usually we open the application 6 months before the intake, sometimes about 8 months. So you can actually check the applications from time to time. That will be helpful. All right. And okay, there's one question over here. I try to rephrase it. The supply of dental students um, in are they in demand, especially in developed countries, say probably in the Western countries and also in Malaysia? Are dental students in demand, I believe?
Yes, definitely. Because it's not only the dental student number is increasing, the population is also increasing. The diseases are also increasing. The spectrum is also so. Like I think, looking at the current situation, we need a lot of dentists to even reach to the WHO goals. Simple things like this. So definitely, the population is increasing. the trends will change, means that with aging population, more of the dentists will go towards gerodontology or geriatrics, dentistry, or things like this. So these trends may change, but the demand will be quite big for the future. Like next 25, 30 years, we can see that the demand is there. It is skill on the list. Dentistry is very high, I think second on the global skills required list that they require.
Oh, wow. Okay.
Yeah.
Two more questions, probably. This question was posted some time ago. Interesting question. I'll try to rephrase the question. It's actually, are you able to detect the health condition of a patient by looking at their teeth, gums, or oral cavity? Yeah.
Okay, for that, as I mentioned earlier, we need to have radiographs, we need to have visual clinical examination, different things needs to be done. So, for example, if I need to see caries, one is the first thing I will do is just like the visual inspection. Clinically, I'll see if I see dark brown or black spots, then I can say that there is caries. But confirmatory test will be all from X-rays, so I will use definitely X-rays to confirm that the patient have how much caries or it is a caries or stain. So definitely as a trained dentist, I would know that it's a stain or dental caries, but I'm just giving an example that the X-ray and clinical examination are quite important aspect in detecting this.
Sure. Another question is that what is the class size?
Okay, class size we have currently you can 100 student we can take. A current student size we have almost 80 students, 78 students in our uh, first year.
All right. We have a question, how competitive it is for a dental physician in local and also overseas.
Okay, that is it depends on like how I should put it. Like from the graduates, our IMU dentistry graduate, few of them, in fact, majority of them, they have started their own private practices. I'm really proud of them. They work for 2 to 3 years with different people, clinics in KL or Johor, different area in Penang, Ipoh, for example, and then they plan their own private practices. And in fact, one of our alumni, he's now hiring our own graduates also. So he has started his second practice also. So that is like the Malaysian environment. So the students or our graduates are doing very well. Um, and those who have joined different practices, they are in a very key positions now. In last few years, they have made very good progress. In New Zealand, I know they are majority of the, in fact, all I know they are practicing there. Australia, they are practicing, and wherever you are in which country, they know that like where the demand is, their general practitioner required. So mostly, I have not heard honestly so far that our graduate is out of job or has no job. All I know all about them because I keep in touch with them. They are all working or doing post graduation.
Okay, thank you, Dr. Mee. In fact,
Welcome.
we're at 3 p.m. now. Basically, I do apologize that we can't take on any more questions, but we hope this talks give you a lot of insights into our dental program. Before we end the talk, Dr. Mee, do you have anything else to add on for our audience?
Yes, they can contact you. Like, if any question I can help them answer, I would love to answer their queries. And uh, the thing is, first of all, thank you. And And if you have any question, please do ask, do send an email inquiry. Definitely we'll answer your queries.
Right. Thank you, Dr. Muneer.
Welcome.
Our audience, we would like to take this opportunity to invite you to our virtual open day this coming Sunday, 24th January from 10 to 4 p.m. At the same time, if you need any information, you can always write to us, call us, or fix an e-meet appointment to speak to any of our education counselors. Thank you, Dr. Muneer, and
Most
thank you
welcome.
everyone for joining this live talk. Thank you.
Thank you. Thank you, everyone. Thank you.